And welcome back. Well, today, a new technology that's easier on patients who need a heart pacemaker, and it doesn't even require surgery.
Imagine that.
Shocking, right?
I know, it totally is. And Dr. Imran Niazi is here from Aurora St. Luke's Medical Center in Milwaukee with more on some amazing new devices that show how far, just how far, innovation has come. Great to have you on the show, Doctor.
Yeah.
Well, thank you.
Thank you for your time. Let's talk a little bit about why someone needs a pacemaker.
Well, people need a pacemaker because their heartbeat stops or their heartbeat gets too slow. We have to realize that the heart has its own natural pacemaker. And as we get older or we get sick, these portions of the heart can get diseased, and then the heartbeat can slow down or stop, which can be fatal.
Mm-hmm. I feel like we hear about pacemakers and stents so often. How common is it to need a pacemaker?
It's not very uncommon. We implant about 250,000 pacemakers every year in the U.S.,
Wow.
perhaps 1 million all over the world.
Unbelievable. When we talk about leadless pacemakers, how are they different from a traditional pacemaker? Because what you're talking about today is something that doesn't even require surgery, and it's called a leadless pacemaker.
That's
right?
correct. That's correct.
Okay.
It's a very innovative device. A standard pacemaker, and if you look at the samples I brought,
Is the standard pacemaker the big gold one there on the end?
the big gold one on the end was the first kind of pacemaker implanted, which required opening the chest.
And how long ago was that? Like what year?
That was probably in the late 50s.
Okay, late 50s.
pretty big.
Yeah, it's big.
Yeah.
What about the next one that's substantially smaller, the silver one that doesn't have any cords connected to it?
It should have a cord, but we just didn't have the cord.
Okay.
It's one of the older devices, but it's implanted following an incision right underneath the collarbone right here.
Okay.
And the pacemaker goes there, and then you see the little wires sticking out of the third one?
Yes.
Yes.
Those wires go through a vein which goes to the heart and are implanted in the heart.
Does that keep it open or does that keep it pulsing?
Well, the electrical current from the pacemaker goes to the heart through those wires,
Okay.
and it signals the heart what to do.
Does the pacemaker have batteries, or do you ever worry about that stopping?
Well, they're very reliable.
Okay.
and they do have batteries, but they don't run down very easily. They generally last about 7 to 10 years down.
Okay.
Wow. Why can't we use those batteries and everything?
If you're willing to pay several $1,000s, you can.
Okay, the flashlight can be replaced.
Yeah,
All right.
exactly.
Good to know. The next two are very small. Are those the newer
Yes,
pacemakers?
those are the newest pacemakers, and they're
No
different.
way. They're like the size of a little bullet.
That's right. And interestingly, they weigh about the same as 2 tablets of aspirin. So they're very, very light. And this allows us to implant them without any need for surgery. In fact, no incisions are made. The devices are inserted through a tube that is inserted into a vein in the leg, and this tube then goes to the heart. The devices are screwed into the heart, and then the tube is removed.
All the
No
way
way.
from the leg.
From
That's
the
right,
leg?
From the leg.
Do you use cameras, obviously?
Yes, we use fluoroscopy, which is a form of X-ray,
Okay.
to look to see if you're in the right position. And that's how we determine where we are.
Is this typically robotic or is this done by you as a doctor?
It's done by an operator, myself, or another physician. He is manipulating the catheters and manipulating the tubes that go into the heart and screwing that in.
Well, I think it's amazing. What do you think? I mean, with how far this technology has come, even while you've been practicing medicine?
Well, I've been practicing medicine quite a long time, but you're right. It is amazing because in the first days when I started practicing, maybe 25 years ago or so, physicians had to open the chest in order to put in a pacemaker. And now we can do it without surgery.
Unbelievable. It's unbelievable.
I think for patients, too, who need this type of device, it's got to be comforting to know that there's not as much trauma to the body as opening up your entire chest. Talk us through this diagram or this picture that we're seeing. What is this?
Well, that picture depicts one of these leadless pacemakers, and you can see that there is a blue tube that is passing into the heart, and there is a white cylinder at its tip. That's the case that holds the leadless pacemaker. Then the pacemaker is extruded from that white tube into the heart muscle, and then the blue tube and the white case is removed.
Huh. So that thing that we're seeing, that we saw, the little bullet-looking thing, that's just the case.
That's the pacemaker itself.
That's the pacemaker itself, so
Yes.
that's what comes out of the casing.
That's what comes out of the case.
Do those have batteries?
The battery is enclosed, all the circuitry is enclosed in that tiny thing.
And I bet the
Phenomenal.
outcomes are so much better because you don't have to open up the chest.
We have to be cautious when we talk about that because this is still an investigational trial.
Okay.
The first one in Wisconsin of this kind of device.
So why did you guys decide to get involved with it?
Well, as you know, St. Luke's is the heart hospital, and we've been engaged in cardiovascular research forever. We did the first heart transplant in the Midwest in 1968. I think we also did the first left-sided bypass surgery in the early 60s. And that's our tradition. We always try to do something over and above what other people can do to benefit humanity. That's part of a job.
I think it's wonderful. Just the advancement that you're potentially creating through this trial right here in our backyard at St. Luke's Medical. It's wonderful. People can learn more about the leadless pacemaker and more information about cardiovascular services at Aurora Health Care at 1-800-649-1989. Thank you so much for being here, Doctor.
You're very welcome.
That's great.
Fascinating.
Yeah.